All right, thanks, Kurt, and thank you for everyone for coming. I'm Andy Weibel. I teach philosophy at Muskegon Community College here. I'm also the director of the Ethics Institute at Muskegon Community College. And so I want to talk about justice and ethics in healthcare in our system. I thought I'd start off, we've heard a few stories, and I'll start off with a couple that to kind of set the stage. I had a student once who wasn't doing so well, and I went and I asked him why he wasn't doing so well, and he said he was unable to study because he lived with his father, and his father was abusive and wouldn't let him study. And I said, well, can you leave and live elsewhere? And he said, no, because I'm also on medication, and I will not have health care insurance if I leave my house. Another quick story. When I was growing up, there was a friend of the family. They owned a grain elevator in town. Not a big business, but they were surviving. And never had health care insurance because it was too expensive to get for him and his family. And the gentleman that owned it, he had a heart attack. Went and had bypass surgery. He became, the bills were too much. He lost his business. He went bankrupt personally. And he's still alive, though, so he did survive. His son, though, was 2 years older than me and a good friend of my brother's, and he had his own small business. He couldn't get insurance because of pre-existing conditions, and he had to buy it on his own because he was a small business, and he ended up dying at age 37 from a heart attack. So I think that, you know, those are the stories we hear all the time. We're a so-called superpower, but if you look at the ratings, we're 37th in the world when it comes to health. So should a society like ours not cover all of its citizens? As Kurt pointed out, we do cover a lot of people. We have Medicaid for those who are the poorest. We have Medicare for the elderly and disabled. But there's a lot left out in between. So we have 47 million people without health care insurance every year. We have 700,000 people every year go bankrupt due to health care expenses. And so I think we should think about what type of society we want to be and what a just society looks like. Does a just society let 45,000 people die every year for lack of medical insurance? And so what is justice? Well, I think justice boils down to giving people what they deserve. So the question is, do people deserve, does everyone deserve health care insurance? We do provide universal coverage for some things. Education's one of them. We think every child should get a universal education, regardless if they're rich or poor, black or white, regardless of their sex. A lot of times it boils down to rights. We say, is there a right to health care? Well, if I have a right, then I deserve to have it. Well, if there are rights, there are also obligations. So who's got the obligation to provide that health care insurance? Is it the government? Well, that's one option. Or do we require everyone to pay for their own health care insurance? Well, as we often know, it's very hard for people to pay for their own health care insurance, given how expensive it is. That's why cost containment is so important. So if we require that everyone have health care insurance, and we say that's a right that everyone should have, do we say it's an obligation for those who don't even want health care insurance, that they have an obligation nonetheless to get it? Think about 45,000 people die every year due to lack of medical insurance. Can you imagine what we would spend if there was a catastrophe and 45,000 people died in a hurricane or a terrorist attack? We would spend trillions in order to take care of that. And I'm sure a lot of people went to Katrina to help in Katrina. A lot of people went to New York after 9/11. Well, we have that happening every year for lack of health care insurance. So should we pay for it? I think, well, we'd be willing to in these other areas where people are dying. Why not with health care insurance? Be a question I raised. So I guess the first question I have is, do you believe that a just health care system would cover all citizens?
Interesting. So we've got quite a bit of agreement there. Quite a bit.
All right. The thing I talked about, I wanted to mention was bias. Some people pay more for their health care insurance than others. Sometimes you avoid that by getting your insurance through work. But generally, who pays more for their health care insurance? It's those who are sick pay more, or else they can't get health care insurance. If you're older, you tend to pay more for health care insurance, probably again because you use it more. If you're a woman, you tend to use more health care, and hence it costs more to get health care insurance. Those are some categories that we think about in terms of health care where there is bias. Now, some will say, well, if you use more, you should pay for more. But we might think about, is that right? I mean, women provide a great service to society. I want to thank my mother today for her help. And so should we charge women more because of the childbirthing that they do and the other health-related issues revolving around that? Should we say the older you get, the more you have to pay because you tend to use more health care when you get older? Or should we think about gratitude and say, hey, they've done their time, maybe they deserve to be covered and not be charged more? Also, interestingly, who pays more are those who don't have health care insurance. Just a quick story with my mother. She didn't have health care insurance because she wasn't quite 65 and couldn't afford to get health care insurance and had lots of pre-existing conditions. But she needed to get a blood test done. She called the hospital and said, how much is it going to be? They said $600. She said, oh, I think I'll go without. I said, Mom, call around. The next one was $300. The one after that, $150. So she went with the $150 one. I had to get the exact same test about 2 months later. I got my bill from Blue Cross Blue Shield from the insurance I got here at the college. It was Blue Cross Blue Shield paid $50. So I paid $50. My mother, because she didn't have health care insurance, paid $150. Often, it's even more than that. My second question is, should people who use health care more and cost more pay more for health care premiums? Oh, so no.
Oh, interesting. Any?
I think there's other biases as well. Gays and lesbians, even if you get domestic partnership benefits from your employer, which some provide, gays and lesbians have to pay. They have to pay taxes on their health care insurance, where most people don't. So there's an inequity there. So there are other biases around, as well as the ones I've just mentioned.